calcium is a cation. It's Ca2+. It has a positive 2 charge. It's the most common cation in the body. The other most important cation is magnesium, and then we have potassium. Now, the main functions of calcium, number one, bones. Now, with bones, we have to include teeth. Okay, so 99% of the calcium is in the bones and teeth. Now, I find it fascinating that when a baby is growing in pregnancy, it develops its bones after week 10, and the bones become much denser in the 3rd trimester, so in the last 3 months. And that is when a woman's requirements for calcium go through the roof. And if she is not eating calcium or able to absorb calcium, it will be stolen from her bones and teeth, which is why women in the 3rd trimester of pregnancy can have problems with pelvic pain, spinal pain, joint pain, and they get holes in their teeth. No kidding, they do. And then there's another 1% mixed into the intra and extracellular fluids. But the skeleton and the teeth are the warehouse, and we steal from that warehouse. Hopefully not too soon. I think our bone density increases through childhood, teenage years, and becomes its most dense mid-20s, and then it goes down from that point. So if you have not reached your maximum bone density by that time, you've got a disadvantage for the rest of your life. Calcium is also involved in blood clotting. Now, last week we did vitamin K, and I did point out here vitamin K is not the only vitamin or hormone involved in blood clotting. It's a series of factors, and calcium phosphate is one of them. So always think of calcium deficiency with blood noses or any sort of blood clotting problem. It may not be vitamin K. It's also important for neurotransmitter release from the nerve terminals. So at the end of your nerve terminals, looks a bit like a mushroom. The nerve neurotransmitters go along the axon of the nerve, get to the ending, and they need to be released from the ending and go into the next nerve. So if your neurotransmitters are not released properly, you won't get the value of some of our key neurotransmitters, and I'm thinking of GABA and serotonin. Now, as I said, calcium has a pacifying effect on the body. It makes the body calm down. So I'm thinking the neurotransmitters we're talking about here are the downers. So they are serotonin, our happy drug, and GABA, our relaxing drug. So calcium can make you feel more relaxed. It's also used for cell signaling, and it's complex cell signaling, and it's a messenger system, and it's how cells talk together, basically. So cells need to talk together when they're reproducing, so cell proliferation, differentiation, embryonic development, like in early pregnancy, icosanoid formation, so inflammatory activity, the immune response, fatty acid oxidation, all sorts of metabolic issues. It's also for muscle function. So most people think muscle, they think magnesium. Now, your muscles are not just full of magnesium. They do a dance with calcium. So when a smooth or skeletal muscle contracts and relaxes, it's a dance between calcium and magnesium. If you don't have enough magnesium, you have tense muscles. If you don't have enough calcium, you have weak muscles. I always think of calcium as muscle strengthening. So if you've got flabby muscles, muscles that sort of have no tone to them, muscles that are too relaxed, muscles where you can't build up your muscle even when you're going to the gym, I think of calcium I don't hear that very often, but I know that to be true. Now, when it comes to bone mineralization, if you don't have enough calcium and you're a child, you will get rickets. We've talked about rickets before. Rickets can happen with a calcium deficiency, a magnesium deficiency, or a vitamin D deficiency. And if you have a child that has rickets, unlikely in Australia, but here it says we've got cases emerging, particularly children with parents that are not providing a calcium-rich diet or supplementation. So rickets are when the child has legs that are bowed or curved. So this is soft bones, basically. Soft bones that don't have a strong calcium matrix. And rickets improve with very high doses as fast as possible. Osteoporosis is a complex problem. It can be lack of calcium, it can be lack of vitamin D, it can be lack of hormone, it can be lack of magnesium, all sorts of things, but not enough calcium, frank deficiency is quite common. So to maintain bone density, okay, so calcium gives bones that strength, but calcium is actually quite brittle. So if you're from the old days where we used to have classroom lectures in primary school with chalk is pure calcium carbonate and it's brittle, it snaps off, but it's very, very strong. We need other minerals in our bones to give our bones strength so they don't become brittle. Osteoporosis is brittle bones, rickets is soft bones. So always pays over 50 to get a low or a bone density test. Now, aside from bone, cell signaling and function. So when the cells do not communicate very well, we could get colorectal cancer, too much potassium, not enough calcium in the blood, could be used for an overactive parathyroid, could be used for hypertension. So those last 5 things are what we use calcium for when it comes to cell signaling or healthy cell development. Let's just say that. Now, muscular function. Like I said, calcium, magnesium do a dance in the muscles, and calcium helps the valuable relaxing neurotransmitters from being released. So where we have tension in the body, calcium is good. Hypertension, our arteries have a ring of muscle around them, and when that muscle gets tight, we get hypertension or high blood pressure. Preeclampsia is basically high blood pressure for pregnant women in 3rd trimester, and both of these types of high blood pressures are very responsive to calcium, also very responsive to magnesium and potassium. So I'd highly recommend, if you're going to treat hypertension, to use all 3. Most people just use magnesium. That's the fatal mistake. You really need calcium as well. Premenstrual syndrome. Everyone uses magnesium, but they forget that calcium is also very good for premenstrual syndrome, or both together. Now, why would you not have enough calcium? Because it's absorbed in the small intestine, so any problems in the small intestine are an issue. So, gallbladder problems, irritable bowel syndrome, irritable bowel disease, lots of coffee and black tea. Never have your calcium containing food with coffee and black tea. Now, a lot of people like to have tea and coffee with their meals, and it's a bit of a no-no. It's not good for your iron absorption or your calcium absorption. Lactose intolerance is a problem of the upper small intestine, so exactly where calcium is absorbed. If you've got a lactose intolerance, that means you've got SIBO, you've got bad bacteria in that area, and you're going to get malabsorption of everything, including calcium. High sodium is not good for your calcium levels. high intakes of other divalent minerals, and that is potassium and magnesium. You need more calcium at menopause and after. You need calcium when you're a child and a teenager. Now the elderly, it's all very well giving the elderly calcium, but whether they absorb it or not is the problem. If you give the elderly too much calcium and they can't absorb it properly, they can't distribute it in the right place, they will get calcification, particularly in their joints and especially in the fingers. So watch out for that. You need to make sure that they're able to deal with the calcium that you're giving them. Therefore, you have to look at vitamin D and all the things that help calcium, and you've also got to make them stop drinking their tea with their meals. Alcohol and drugs and low calcium diets, low protein diets will mean that you need more calcium. If you have any of the bone disorders, and there's lots of them, osteoporosis, brittle bones, osteopenia, soft bones, osteomalacia, low vitamin D, children, rickets, soft bones, stunted growth, high levels of lead, would you believe? Now, it's very common when you do a hair analysis for a child, you will see high lead. And it took me many years to understand that, but it's not so much that that child or even adult is eating lead, it's because they don't have enough calcium to keep the lead out. So when you see high lead in anybody's reading, you've got to then look at the calcium levels and go, calcium's very low, that's why the lead is creeping in. Calcium will oppose lead and push it out. If the lead has crept in, those children are very vulnerable to autism. It doesn't have it here, but it does have irritability, low energy, loss of appetite, behavioural problems. So lead will change a child's personality. It will make children, it will lower their IQ. It will cause all manner of behavioural and learning difficulties. So there's a clinical tip. Lack of calcium will give you muscle soreness, cramps and spasms. I must stress here that there are spasms and spasms. So magnesium spasms are twitches, also chronic spasms in the head, neck and back. Tight muscles are magnesium, but for calcium, the type of calcium problems are cramping in the calves at night, cramping in the feet, fingers even at night. Calcification occurs at night. So there's cramps and cramps. First thing to ask is day cramps, night cramps. Is it continual muscle tension or not? Now, the soreness that comes with calcium deficiency is more that the muscles are weak. They're weak and they can't cope with much stress. So if you're low in calcium, you have weak muscles and you can't run a race. And if you run a race, you don't have the power in your muscles and they get very sore. Obviously, blood pressure is one issue. Now, as we get older, it's more likely we get blood pressure. So it's also more likely we become calcium and magnesium deficient. And then we have heart rhythm. So the heart contracts and relaxes, moment by moment. And if that contraction and relaxation process doesn't work, then the dance between calcium and magnesium is not working. So we get a regular heart rhythm or arrhythmia. Then a weird one, paresthesia affecting the mouth, throat and limbs. Paresthesia is not being able to feel something, so it's numbness. Now, I have had a client that has said to me, I've got numbness in the mouth. And at that time, I had no idea what to do about that. But odd types of numbness, let's just say that. Mental disorders, anxiety, depression, confusion and psychosis. Now, we have an epidemic of anxiety out there. I am a big fan of giving calcium for anxiety, especially when magnesium hasn't worked. The type of anxiety it usually is when someone can't quieten their mind at night. So they stay up all night and they're not able to get to sleep. Now, too much calcium. If you take too much calcium as a supplement, you'll turn to concrete. Things will become slow, relaxed, and hard. So you will get constipation. Your bowel will go to sleep. Bloating and flatulence is underactivity or sluggishness. You will get the increased risk of kidney stone formation because the kidneys have got to try and get rid of it all. Your high calcium in the blood will give you a headache, pain in the abdomen, lots of urination, no appetite, and that's the problem with calcium. If you take calcium with your food, you'll actually get alkalinization of your stomach. So you'll give yourself pain in the abdomen and discomfort. We've got weakness, and it's a muscle weakness here, like I can't drag my muscles around. Elevated CSF protein, heart dysfunction, mental confusion, muscular weakness. Current research. Calcium supplements in healthy individuals are not needed according to this research, nor are they required in most people receiving treatment for osteoporosis, where they have not been shown to affect treatment efficacy. Now, this is just one study. I'm not really in agreement with this, but maybe more studies have to be done. It is true that calcium supplements cause constipation, bloating, and kidney stone, but that is if you don't need it. And some evidence suggests that it causes increased risk of myocardial infarction, or heart attack. Now, again, anything that you take and you don't need will always cause you a problem. No issues there. If you're healthy, you don't need calcium supplements. There was a problem in previous decades where if your doctor thought you were menopausal, or you had low bone density, or you were over 50, they would say you need to take calcium tablets for the rest of your life. That was the advice. Of course, now we know it's more complex than that. We know that you can't just give calcium supplements and say, good luck, see you later. I believe it was causing a lot of problems like calcification in the joints, underactive digestion, and all sorts of things. So I was never a fan of that strategy anyway. But what we're trained to do is to pick and choose. So you've got to learn to pick and choose those that need calcium and those that don't. Now, I have personally overdosed on calcium. So it wasn't pretty. Yes, I got constipated. My muscles turned to concrete. I could hardly move, and I was tired all the time. So I had to pull back on that. And I realized through that experience that I did not need calcium. I was one of those people that don't need calcium, but there's plenty that do. I've noticed something really interesting, that with couples, one needs calcium and one needs magnesium, and that's how nature works, especially if it's male-female and that there's that attraction to reproduce. So it's common that one person in the partnership will give the other the same supplements and say, well, it works for me, it should work for you. Never works like that. You're always attracted to the opposite genetics. So please keep your calcium tablets to yourself if you don't need them. Blood tests. So yes, when you go and have a normal blood test under electrolytes, you will see calcium, and you will see total calcium there, and you'll go, oh wow, fantastic. This blood test has measured my calcium. It has nothing to do with your deficiencies. You have to understand with blood needs to be perfect all the time. So your blood will take out calcium from the bone, calcium from the muscle, calcium from the teeth, calcium from the nerve endings, and it will put it in the blood. and your blood calcium will change only as a last resort. And be very aware that if your calcium is not right, you're on the brink of a heart attack. So this is very confusing for new practitioners and clients, because when you start talking calcium, they'll pull out a blood test and say, my calcium's fine. Thank goodness it's fine. It should be fine. The other tissues are not fine. Blood is not the only tissue. Blood is the priority in the body. Now, there are other tests. There's an alternative test you can do, and it is testing the amount of calcium that you excrete through the urine in a 24-hour period. Now, I've done this with my clients. It is an alternative test, but the reason why you would do it is for, let's say we have a client with osteoporosis. Now, the government will only allow an osteoporosis test every 2 years. So if you're going to treat someone for osteoporosis, then what is the point in saying, go and have these supplements and come back in 2 years? But for those urine tests, you can have them done every 3 months to see what the calcium excretion is like. And in the case of supplementing with calcium, and in the case of using calcium for bone density problems, you would expect that that urine would be less high in calcium, or it would have been decreased. So let's just stop there.